Hello, Cam followers. It is 7:30. It is on Thursday, and I have an awesome guest for you tonight. I am sure it's going to be an extremely busy evening because the topic is quite an interesting topic that we do come across a lot in our, especially our senior pets. Awesome guest who I met in Moscow, who's a really dear friend of another one of our guests, Giulio Spettini. That's who introduced me to the awesome Federico Fracassi, who is a global expert in hypothyroidism. We only ever bring you the best. So he has taken a lot of pinning down. He's currently in Istanbul in a hotel room because he is lecturing around the world at the moment. So we're really, really, really lucky to have him. The internet there is just a little bit jumpy. So the audio is really good, but sometimes the picture doesn't move to match. So just bear with, please.
Finger crossed. Yeah.
And before I let Federico introduce himself and tell us all about him, I'm just going to say thank you to our sponsor, which I'm sure all of you now know. We are very, very lucky to have Big Barker Beds sponsor Cam. They are an orthopedic dog bed company based over in the US. I'm very, very proud to be associated with them because they have put their bed through a pilot study with the University of Pennsylvania to see what impact this bed will have on dogs with osteoarthritis. And in this pilot study, they did show that there was an improvement in mobility, in the level of stiffness, in their quality of sleep. So because Cam really believes in evidence-based medicine and we only bring you the best, we really are very proud to be associated with them because they put their money where their mouth is. They say that this is a really great bed for arthritis, and they've actually proved it. So thanks, Big Barker. You rock. Back to Federico. Come on, dude. Tell us all about yourself.
About myself, I'm an enthusiastic endocrinologist. You know what is an endocrinologist? Is a doctor that is dealing with hormones. And I did my specialization in Switzerland, in Zurich, several years ago. And then I'm back to the University of Bologna in Italy, where I'm doing only veterinary endocrinology. So my specialization is internal medicine, but endocrinology is one of the field of internal medicine. And in my opinion, is the more interesting one. But of course, I love what I do. And so my clinical activity deal with hypothyroid dogs, hyperthyroid cats, dogs and cats with diabetes mellitus. These are the topic where I'm doing a clinical activity. I'm doing some research and I'm teaching. This is my word of interest. And
I love it. So I met him at Moscow at the NAVC Congress, and Giuliolo was telling me that you run a veterinary kind of summer camp for vets to go out and learn all about endocrinology, and you're so bouncy, and even I was like, oh, sign me up. I'll come. This is great. So no, this is gonna be good, guys. We've got loads of people watching us. Please tell us where you're from. You know, both me and Federico have been at work all day. I'm actually still covered in dog poo because I had to run to get here for 7 o'clock. So it'd be nice for you to join in, to tell us where you are. Tell us something about yourself. It's always nice to know the people that are listening in. Do not be shy to ask questions. The topic in hand tonight is very much going to be hypothyroidism. I'm already twisting Federico's arm to come back and talk about Cushing's at a later date, but we're going to try and stick to topic today. So let's go straight in with the very simple thing. What is hypothyroidism, and what is the normal signalment that you see the disease, and kind of give us a bit of a background setting?
Yeah. Hypothyroidism is an endocrine disorder. The thyroid gland is an important gland at the level of the neck that is producing the thyroid hormones. The scientific name is total T4, total T3, and there are some free forms or total of T4 and T3. And the thyroid hormones are extremely important for a lot of physiological activity in the body. And with hypothyroidism, the thyroid stop working properly. So it means that is unable to produce enough thyroid hormones. And this happens for two reasons. The most known one is an immune-mediated process. We know that the immune system can work not properly sometimes and can destroy a gland. And this is exactly what happened with hypothyroidism. The immune system destroys the thyroid gland. And then there is another form that is called idiopathic. We use the word idiopathic when we have no clue why a disease happened. And so we see that the thyroid stopped working, and it's called idiopathic hypothyroidism. These are the two most common forms in an adult dog. Then we have also a congenital form, but this is totally another topic. And so the thyroid gland stopped working, and we have several clinical signs. We will talk later on about the clinical signs, but since this is mainly an immune-mediated disorder, the classical signalement of a dog with this condition is a middle-aged dog. We have to know that most of the immune-mediated disorder are affecting the middle-aged dog. Potentially, we can see immune-mediated disorder, we can see hypothyroidism at every age in a dog that is 1 year or in a 15 years old dog. But typically, the dog with hypothyroidism is a 4, 5, 6, 7 year old dog. There is not a clear female or male predisposition, but there is quite a strong breed predisposition. Potentially, we can see hypothyroidism in every breed. But some breeds are more affected. For example, English Setter, Labrador Retriever, Golden Retriever, Rhodesian Ridgeback, Cocker Spaniel, Boxer, Beagle. The list is quite long, but these are the most commonly affected breeds. So we can see in every animal, but of course, in these breeds, it's a bit more common. So the classical animal with this condition is a middle-aged dog, male or female, potentially of every breed, but some breeds are more represented. And for sure, there is a genetic component. We don't know exactly which is the genetic reason, exactly the genetic reason, but of course, when there is a strong breed predisposition, there is for sure a genetic component.
Okay. So that's given us quite a good background. It's pretty common, isn't it?
It's difficult to answer this question because when we talk about common, uncommon, it depends on what we think it's common. What is common? I tell you, the prevalence, the scientific prevalence is between 0.2 and 0.8%. So it means that when a vet is seeing 100 dogs with several diseases, 0.2, 0.8 dogs, so less than one, has this condition. So it is considered a common endocrine disorder. When we compare all the endocrine disorder, it's considered a common one. But it's always difficult to say common or uncommon. I don't know. If you compare to osteoarthritis or you compare to chronic kidney disease or diseases like this, it's not a common disease. But when you look at the endocrine problems, it's a common disorder.
Yeah. And I think that's something that we're going to touch on in a bit, is the possibility of overdiagnosis as well as underdiagnosis. So do stay tuned. Someone's just said, I have Siberian Huskies and it's very common in the breed. Is that one of the breeds that features on?
Yeah, there is also, I was not mentioning all the breeds because of course there are many. These that I mentioned are overrepresented. Husky is also a breed that we see quite commonly, this disorder in Husky. Yeah.
Right. Okay, so now let's talk about we've known about the age of appearance roughly. What sort of things are people going to see? What's the sort of things that people talk about when they bring it up in front of their vet or in their friends or in their dog community? What's the things that they see?
Yeah. There are, in most of the cases, they are not. It's not easy to recognize the clinical signs. There are two main clinical signs that are the metabolic signs and then the dermatological signs. So what we the metabolic signs are the lethargy. Dogs are starting sleeping much more than normal. So they can have a weight gain. So they eat normally, but they start having a weight gain. And in rare cases, we can reach obesity. Then exercise intolerance. They become quite weak. They don't like to walk too much. And also cold intolerance. They don't like to go outside when it's winter, so they have cold intolerance. And then a lot of dermatological problems that are seen in more than 60% of hypothyroid dogs. So hair thinning or alopecia or dry hair coat, hyperpigmentation of the skin, and the so-called rat tail. The tail of the dog becomes like similar to the one of the rat because they are losing hair coat. These are the most common clinical signs. But then, since the thyroid hormones are important for every cell of the body, other organs can be affected. For example, in some cases, we can have neurological problems like polyneuropathy, facial nerve paralysis, vestibular syndrome, or problems with reproduction. So they have you don't see the estrus, or there is a problem with the libido. Several problems related to the reproduction. And this is the picture. The most common are lethargy, weakness, weight gain, and dermatological problems.
Okay. And that brings me nicely to a little question from Kelsey. This is slightly off tangent. What if your 7-year-old Australian Shepherd is overweight and you're worried about the thyroid, but the levels come back normal except for cholesterol? I've tried exercise diet, also done a T4. I've gotten lab work almost twice a year for a couple of years now. I don't know where to go from here. So that kind of nicely comes into us talking a bit about diagnosis. And this is where it gets a bit tough, isn't it? And trying to get an accurate diagnosis is sometimes harder than people think. Can you tell us about the process? So say I've just come to you. I'm Kelsey, and I've got an Australian Shepherd, 7 years old, very overweight, has shown lethargy, and we're starting to see some coat changes that are symmetrical, and they're not alopecic, but they just seem a bit dry and a bit scaly. And you're starting to think, could something be going on here? What's your next step?
Yeah. My next step is always perform CBC biochemistry and urinalysis. It's always important for two reasons. It's important to do the clinical, the basic lab work for two reasons. The first, we want to search for potential abnormalities that are connected with hypothyroidism. And the two most common are hypercholesterolemia. The colleague, the person that was typing the question was mentioning hypercholesterolemia, and the other one is anemia. Hypercholesterolemia is present in more than 80% of hypothyroid dogs, and anemia in roughly 30 to 40%. So I do this to look for these abnormalities, but also to search for other disorders that could cause the clinical signs. This is very important because the interpretation of the thyroid profile is not easy because it can be influenced by several other disorder or medication.
So can I just put in there, would you, because a lot of people have set income that they can spend on their pets, and there's a lot of people that are not insured, for example. Yeah. And if they were to go to their vet, would it be wise to suggest doing the CBC, so hematology and biochemistry, get the results, and then second wave do a T4 TSH, or do you tend to lump it all together and send it off to the lab in a one-up?
No, it's much better to wait the results, because we have to invest well our money. So, for example, if from my hematology and biochemistry, it's clear that the dog has, for example, kidney failure or a liver problem or hypercalcemia that is connected to other disorders, it's a waste of time, a waste of money to invest on thyroid hormones. So it's very important. And if I see the typical abnormalities connected to hypothyroidism, it's a very good idea to test the thyroid hormones. I usually do like this because I like to reach a diagnosis and to spend well the money. It's very important to, and another point is that the diagnosis of hypothyroidism is never an emergency. So if you wait 1 week, the results, it's fine. To develop hypothyroidism are needed weeks or months. So it's not an emergency. So I like the idea to wait the results of the basic result of hematology, biochemistry, and urinalysis, and then do a second step.
Okay, so my next question is, what can you have the same blood sample sat at the lab and you say to them, please run the CBC and biochem, and then a day later you get the results and you can phone back up and say, now that I have these results, please use the same blood and now do a thyroid profile. Can we do that?
Absolutely, yes.
Yes.
Thyroid hormones are very stable in the serum, and that's perfect. Even if you ask 2 or 3 days later, it's absolutely fine.
Good. Okay. So then what do you think about clinicians that jump straight into doing a thyroid profile without doing a CBC and a biochem? Just so that owners can understand why sometimes they're in the waiting room and the vet comes back and goes, I want to test your dog's thyroid, but I've got to do this one, and this one. And they're like, whoa, that's 150 quid. Why can't you just test the thyroid? What's the problems with going straight in for a thyroid profile?
It's a big problem because there is the scientific name is euthyroid 6 syndrome. So the dog has no hypothyroidism, but the thyroid hormones are low. And this can happen with concurrent disorders. For example, if you do a thyroid panel in a dog that has a tumor, a chronic infection, or Cushing syndrome, or other severe disorders, you can have low thyroid hormones without hypothyroidism. And so if you just look at the thyroid panel, you diagnose hypothyroidism and you misdiagnose maybe a very important other disorder. And I've seen a lot of this situation when the CBC and biochemistry are not done, and it's a problem. I remember a few weeks ago, I've seen a dog that started the treatment for hypothyroidism because the vet decided not to do the biochemistry, and because this dog had low thyroid hormones. But then I decided to do the biochemistry, and there was a severe hypercalcemia, and hypercalcemia commonly is connected to tumors. This dog had a thymoma, which is a tumor, a chest tumor of the mediastinum, and was treated for the wrong disease and was not treated for the cancer that the dog had. This is a big problem because if you don't diagnose the proper disease, you don't treat it. And if it's a dangerous disease, you lose a lot of time.
Yeah. And that's really hard to get across to owners. Like I'm back in first opinion practice and time is quite limited. You got 15 minutes to greet them, get them in the room or the waiting room, and then you're trying to explain to them as well that it's not just a one test wonder. It's a collection of information. I know also for clinicians, it can be a bit confusing for us because let's jump to a complete other extreme with feline hyperthyroidism. Quite often on those profiles of a biochemistry or in a CBC, you will also have a T4, and you can look at that with a little bit more kind of confidence, can't you? But in a dog, it's very different. Is that fair to say?
Yes, it's true. But in a cat, you can trust more a cat with hyperthyroidism. You can trust more a very elevated total T4 because in cats, usually an hyperthyroid cat, in a 90% of the cases, you have a very high T4, and this is diagnostic. Yeah. Be careful in a hypothyroid dog where a low T4 cannot be hypothyroidism. So it's more complicated, the hypothyroidism compared to the hyperthyroidism in cats.
Exactly. So when people are looking at the T4 level, now let's go into the bit that's going to fry my brain, because we have to do the T4, the TSH, and there's the TRH, and sometimes we can sit there going, can you explain to people why they understand about euthyroid and T4 might be low because of another condition, but then what do clinicians do to substantiate the low T4 readings? So they've got the biochem, it's got a hypercholesteremia, they maybe got a bit of anemia, the dog's overweight, it's lethargic, and we've got a low T4. What else do we do?
Usually after the hematology and biochemistry, I don't do just a total T4. I measure always at least the total T4 together with TSH. Because when you measure both, you have much more probability to reach a proper diagnosis. Because in what is TSH? TSH is an hormone produced by a gland that is a hypophysis that stimulates the thyroid gland. So when the thyroid gland is not working anymore, is not producing the T4, the hypophysis that produces the TSH is producing more TSH to stimulate the thyroid gland. So classically, a hypothyroid dog have very low T4 and high TSH. Also in humans, many people are affected by thyroid problems. And when you go to the doctor, immediately the doctor does not measure the T4, measure the TSH, because it's really precise in telling when TSH is high means that the body is not producing enough thyroid hormone. So my advice is that after hematology, biochemistry, the basic lab work, run a total T4 and TSH together, because the possibility to reach a proper diagnosis is much higher.
Perfect. And is there any other kind of like situations where that's going to fail? Because I do feel for owners when we get blood works that's not quite clear. And it's so hard to explain that it doesn't come out as a perfect answer. Here you go, classic. And it can be quite confusing. Can you think of situations where you've had a hypothyroid dog and their thyroid and TSH haven't been conclusive and definitely the disease?
Yeah, this is why when I start a consultation and the dog could have hypothyroidism, I speak very clearly to the owner. We can be lucky and we confirm or we exclude 100% the disease, but there is always a gray zone. And in hypothyroidism is pretty common, unfortunately. So what I explain to my owners that we run this test. In some situation, I have a clear no hypothyroidism, a clear yes, hypothyroid, but we can have non-conclusive results. In these cases, it's more complicated, and we should do other tests that are usually specialistic tests. One is called TSH stimulation test. It's a test that stimulates the thyroid gland, or we can run a scintigraphy. It's quite complicated, but I usually speak clear to my owners. It's very important to reach a diagnosis, because hypothyroidism is a disease that, if it's present, needs to be treated for the rest of the life of the dog. And if we diagnose this properly, we do a proper diagnosis, the dog will be totally fine for the rest of his or her life. Otherwise, it will be a nightmare. So in my opinion, and I try to explain to the owner, it's important to invest this money, because we have to do a proper diagnosis. Yeah.
And I loved what you said earlier before we went live, is that when the dog is hypothyroid and you give them the thyroxine replacement, bing, they are back. It's so, you said to me, I love treating hypothyroids because the response to the medication is incredible. And I've seen it, and I'm gonna put the link into why we've got this with regards to osteoarthritis, which is what CAM is about. Is I was telling Federico that I was treating a dog called Max, And we'd watched him start to decline, and we were like, oh God, he's got terrible arthritis, lots of myofascial pain. And we were really like, this is OA progressing. We're losing the fight. We'd been combining the multimodal approach, and we'd done a blood test, and nothing had really shown up previously. His thyroid, his T4 level was pretty normal. He didn't have hypercholesterolemia. So we parked it, and we were like, oh, it's coming towards the time. And then luckily for us, Max had a weird fit. He had like a seizure-y type episode, which made us just go, stop, let's look at this again. And we repeated the bloods about 3-4 weeks after the previous one. So this owner had spent 150 quid, parked it, and then we're saying to her again, can we do it again? And she re-spent that money, and there it was. And it was like, right, we got something to work on here. And we put the dog onto levothyroxine, and good God, and it made me realize that I had been a clinician that was just seeing the dog demise, thinking it was OA, osteoarthritis pain, and it wasn't. And I was like, this is so bad. And this, I think, is quite common because we've got a disease that is more prevalent in the middle age to older generations. It's very well established in the medium to large breed dogs, which is classic OA territory. And I'm pretty sure this is a common scenario. So this is why it was really important for me to bring this into conversation in CAM, because there is a lot of overlap here. And I want you, the followers, to not think that your clinician, your vet, is having you over a barrel. They're not trying to get money out of you. It's not a way for us to regularly get income. We are honestly looking for comorbidity because it happens. And we wouldn't want to prematurely say goodbye to your pet when it was another condition that we could treat. Is that fair to say?
Yeah, I totally agree with your idea, because it's important. So, because we don't accept that our dog could have more than one problem. Okay, I already have a diagnosis, so my dog is sick for that kind of disease. It's possible. But I've seen so many cases that they were doing not well because this diagnosis and is not responding well to treatment. Yes, of course, it's an option, but all the time, especially when they are not doing fine with the treatment it's abnormal, their response to treatment, they are not doing fine, search for a concurrent disorder. And hypothyroidism is a good example. It's not the only one. So if my dog receive a diagnosis and expect, if it's doing very well, okay. But otherwise, I usually search for other disorder. Yeah. And hypothyroidism is one of these.
Yeah, and I think I don't think it's as clear cut as with treating hypothyroidism, and you see just like this pizzazz, I'm back. But osteoarthritis likes non-steroidals. It likes anti-inflammatories. It does well. So if you've got a dog that you really suspect to be arthritic, and you put them on an anti-inflammatory, and you really don't see significant improvement, do think is something else going on. Don't kind of go, oh, well, he didn't respond, he's just getting old, I'm just going to, oh God, do think, is there something else that is affecting this clinical picture? And I know from working with clients on a daily basis, that fear of more commitment, more expense, more heartache, more emotion, trying to get the answers, it is tough for you guys. It really, really is tough. But I just want to plant the seed that we as clinicians often have to look a little bit harder. We've got expectations. And I do my consults now by saying, within 3 to 5 days, I'd expect your dog to do this. And within 3 to 4 weeks, I'd expect them to be doing this. And if we're not getting there, we've got to think why. Either you're not being compliant to the advice being given for the multimodal approach and you're not giving your medications properly, or there might be something else going on. So that's why we're talking about hypothyroidism alongside canine arthritis management today. So let's now kind of go and start talking about some of the more weird clinical signs. You touched upon them. And this is how I want people that have got dogs that have become a bit doddery, they've become a bit weak. Just because sometimes hypothyroidism can look a bit like that, can't it?
Yeah. Unfortunately, this is a quite unspecific clinical sign because it's not a clinical sign that is pathognomonic. You can, weakness. If you search, for example, weakness, you have this clinical sign for so many problems, so many disorders. So, of course, you don't have to focus your attention on hypothyroidism. This is a really generical problem. But hypothyroidism exists. So for sure, you have to think about that. Yeah. And may I comment your previous, what you was mentioning about the use of non-steroidal anti-inflammatory drugs for osteoarthritis, that they are very important. And you was mentioning a dog that is not responding well to the treatment. I totally agree. Search for concurrent disorder. And I am an internist in general. Check the kidney function of these animals because we know that we can use the non-steroidal anti-inflammatory drugs, but they could have some side effects in some dogs. And we know that gastrointestinal and nephrological problems connected to them. So a dog that is receiving non-steroidal anti-inflammatory drug and after some days is not doing better or is doing a bit worse, I would recheck also the kidney function because maybe this dog had a subclinical, subdiagnostic nephropathy. Sorry if I...
Yeah, no, absolutely. And that gives us the opportunity to just use a little platform to talk about what would be a clinician's ideal situation with an owner with a newly diagnosed OA dog. We all want you to do a blood panel so that we can ensure that when you start on any medication, it doesn't matter what it is, that we've got any forewarning that there might be a concurrent problem that's bubbling under the surface that medication might interfere with. And it's always really distressing for me because personally, I really love analgesics because I see dogs that have been in horrendous pain become pain capable. They like, I'm not going to say pain-free because it actually is impossible. But, when you can see them go, thanks. So I love analgesics and I hate them getting bad press. And a lot of the time they get bad press because of a concurrent condition that we didn't note, we didn't find, we didn't look for. And then the analgesic gets the blame. And I'm like, no, don't tar them with that brush because they're very good at their job if you put them in the right crowd. And we just didn't check the crowd that we put them in. So as owners of arthritic dogs, please see the benefit of getting a baseline blood level sorted really early on into your condition so that you can make sure that you're making the best decisions. Because as Federico says, if something works, it's very likely it could have an adverse event. And that's kind of the laws, isn't it? If something's really got a medical impact, it's going to have a medical effect.
Yeah.
That medical effect could be an adverse event. Make sense, I hope.
Yeah.
Anyway, let's move on. Let's now talk a bit about, we are going to do questions, guys. And whilst you're here listening, guys, tell me where you're from because this is interactive. I'd like to know where you're listening from. We like to be global. Tell us about treatments so that people can understand it's actually not a big deal. It's a good situation. And then reassessment of blood values. What kind of commitment are they getting involved in once it's been diagnosed?
Yeah. Fortunately, the treatment is easy. So the diagnosis is complicated because it's sometimes not easy to understand if it's true hypothyroid or not. The treatment is easy because the thyroid gland is not producing any more thyroid hormone, and we give the thyroid hormone. So this is a quite we try to transform what is not physiologic in physiologic. And this is the reason why as soon as we give levothyroxine is the synthetic form of total of T4, the dog suddenly in a few days is doing much better, more active, more happy, more willing to play, and the hair coat is improving in weeks or months. Of course, it takes more time. And to consideration, we have several products on the market about, but I don't want to talk about products. Several formula usually are tablets, or there is also a liquid like a syrup that can be administered orally and can be given once or twice daily. It depends on the product. What is important to remember that the dogs needs much higher dosages compared to humans, about 10 times higher. And this is important because sometimes the owner and the dog both, they have hypothyroidism, and sometimes the owner are asking why my dog is receiving a dose of levothyroxine that is 10 times higher than the one that I'm receiving. The reason is that the absorption of the medication at the intestinal level is lower in dogs compared to humans. So the treatment is very easy. You start giving tablets or this liquid formulation. The dog is doing much better, but of course, like with every hormonal replacement therapy, we have to adapt the dose to the single animal. For some animal, the fixed classical dose is too high or too low. So therefore, usually after 1 month of treatment, we recheck, we reevaluate the dog. We ask the clinical signs. For example, an excess of thyroid hormone supplementation usually is observed in dogs that have polyuria and polydipsia, so are drinking and urinating more, or they are very nervous, or they are losing weight. And we have also some way to check with the lab. So usually we measure the total T4 after 4 to 6 hours after the drug administration. So usually when I do a reevaluation, the owner comes to my praxis at noon, and I ask the owner to give the pill at 8 a.m. So after between 4 to 8 hours is the maximum absorption of levothyroxine, and we can check in the blood if the level is fine or too low or too high, and we can adapt the dose.
Perfect. And how frequent is that blood test needed? In that, if you've got a dog that's done really well, and you've had them on the levothyroxine for, I don't know, a month, and they've come back, they're like, he's doing really well, we've got some weight loss, his energy levels come back. What timescale do you do that first assessment? And then if the dog continues to do well and it's nicely within reference range, what's the frequency it should be checked? Because a lot of people fear the outlay. They really fear the cost.
Yeah, usually my protocol is this one. Of course, with all the time that when we start a treatment, we have to do a bit more reevaluation initially. So usually I recheck the dog after 1 month after starting the treatment. Then if it's doing the dose is right, I recheck after another month. And if it's fine, I recheck 2 times per year then. Because it's important at least 2 times per year to check if that dose is correct or not. Because in the long term, it's possible that the dosage becomes too low or too high because of the metabolism or other factors. So I would say 2 reevaluation initially, and then 2 times per year. And this is important for a chronic disorder that needs a treatment for the rest of the life of the animal.
Yeah, and because you said as they get older, the metabolism of the thyroid hormones changes as well, doesn't it? So it is likely that your dose will be adjusted with age.
Because they are changing the body weight, for example, and they are changing the metabolism, and it's not possible to predict if with time we are decreasing or increasing or keeping the same dose. Simply all the time when we give a chronic treatment, a long-term treatment, we have time to recheck our animal.
Perfect. Somebody says, what level should it be when you're looking for control? You know, so when you're doing your reassessment, I don't know if this person's a clinician. They might be.
Yeah. We have to evaluate two things. We want a dog without clinical signs, so all the clinical signs of hypothyroidism are gone, and we want the total T4 that is close to the upper reference range, so the upper part of the reference range, because since we are testing the T4 about 4 hours after drug administration, so it's the maximum effect, maximum absorption of the medication. We want that that moment, the total T4 is close to the upper reference range of the lab.
Perfect. So I'm going to dabble into something a little bit difficult. Then we're going to come back to the topic that we said we would cover, which is going to be behaviour and hypothyroidism. But first of all, I just want to help this Katerina. We're not going to talk about Cushing's today because it's just a big topic. But do you commonly get dogs that would have Cushing's and they could also be hypothyroid? Not commonly, it's a bad word, but is it possible? And
yeah, is it possible? They have both disorders. The diagnosis of do a proper diagnosis is not easy because the Cushing syndrome is physiologically decreasing the thyroid hormones levels. So understand if it's a true hypothyroid or just the Cushing syndrome is decreasing the thyroid hormone, it's not easy. So the problem is to not overdiagnose hypothyroidism when we have both conditions. But it happens. I don't have a percentage, but in these cases, it's important to treat Cushing syndrome with a medication or other treatments for Cushing syndrome and give the levothyroxine as they were two separate disorders. So treat both. It's possible.
Okay. And when because she was saying because there's been a couple of vestibular episodes, would you ever choose to stabilize the Cushing's and then feel that you can rely more on your thyroid testing once the Cushing's stabilized?
Could be an option, yeah. Here, it's a very complicated answer. Here, in these cases, a good internist, a good endocrinologist is needed. Yeah. Because I was just briefly mentioning about the specific tests like TSH stimulation test or scintigraphy, or there are other, I don't mention all the possible tests in endocrinology because there are so many. I would say that when you have or there is a suspicion of this combination, a good internist is needed because this is exactly the what a specialist should do. And you know, I am a specialist in endocrinology, and I have a long discussion with other specialists in endocrinology about these cases that are extremely complicated also for us.
Yeah, to be honest, guys, I hear it and I get nervous because you're thinking, oh God, this is going to be tough. Something from Karen, just before we go on to the behaviour. Can itchy, dry skin patches and whitehead type spots on a dog's tummy be a sign of thyroid with weight gain, is continually losing fur, being less active?
Poreitis is usually not a clinical sign of endocrine disorder. So also it's not a clinical sign of hypothyroidism. The problem is that when you have a skin dermatological problems, you have, for example, secondary infection, for example, bacteria, pyoderma, or other problems. So for sure, hypothyroidism does not produce pruritus. So in that picture that was taped, the other clinical signs are possible. Pruritus might, if it's connected to hypothyroidism, means that there is something else. So I would say that it's not the typical case.
Okay, cool. This one throws me a little bit. I'm totally out of my depth. What about dogs that have no symptoms, but blood work shows genetic markers? Out of my depth. Please help me here.
I wouldn't say genetic markers because unfortunately we don't have genetic markers today for hypothyroidism. I would say the blood work is showing abnormalities that are consistent with hypothyroidism, for example, anemia or hypercholesterolemia. In these cases, usually we have two possibility. Wait and see, because as I told you, hypothyroidism is not a disease that is an emergency that you have to treat immediately. But for example, if the dog has severe abnormalities, for example, cholesterol that is not elevated, is extremely elevated, I would test that dog.
Okay. Okay, it's good. I need to just say hello to this lovely person. She lives near me and she comes to my clinic. So there you go. How cool is that? Hi, Alison. And right, moving down. Some really lovely comments, which is great. Right, let's go back to this one, because we had a list of myths that we needed to deal with. And there was going to be clinical signs associated, where are we at, and behaviour was a big contender, but then also treatment options. So let's do the fact that a lot of clinical situations are now being linked to hypothyroidism, and behaviour change being one of them. Explain.
So this is a hot topic. When you talk to an endocrinologist, this is a really hot topic, and we had several discussions with people expert in behavior, because in humans they were able to find some connection between hypothyroidism and behavioral problems, and in dogs there is a huge discussion. There are some scientific papers that are saying that this connection exists, but the strongest paper, and one was published 2 years ago from a group of was done in Belgium and the Netherlands. Very strong study looking at the connection between aggression and hypothyroidism, and they look at a huge number of dogs with problems with aggressivity, and they tested for hypothyroidism, and they did also the opposite. They check all the dogs with hypothyroidism to try to find this connection, and the evidence that that this connection exists is very low. So I personally see a lot of hypothyroid dogs because my job is to diagnose hypothyroidism. So I receive several cases that are referral cases, and I have never seen behavioral problems in these dogs that are truly hypothyroid dogs. But the question is still open. We know that we need 4 studies. If you ask my personal experience, looking also the scientific literature, to me, there is not such a strong connection between behavioral problems and hypothyroidism.
And I suppose it's just different ways of people coming to that conclusion. And as I go on my learning journey, I very much am being taught again and again, correlation is not the same as causation. And that's something that I think we fall into the trap of. And as you said, this study in Belgium looked at a large number of dogs that were hypothyroid and assessed them for aggression, and did the reverse, huge number of dogs that are aggressive and looked for hypothyroidism, and looked at the stats. Really was there a link? Whereas what might be happening more in the behavior sector is smaller numbers that are being treated for hypothyroidism, and they've seen an improvement in mood or behavior. So therefore they've assumed immediately that the treatment for the hypothyroid has resulted in the change in behavior. So it's two very respected approaches to having that conclusion. Would that be fair to say?
No, it's this is the science. So this is the statistic, the science, because we can have a lot of, when we look at the medicine, we have also a lot of coincidence. And so the big studies and the statistics is helping us in giving this kind of answers. And it's important. And the other aspect, when we discuss about this kind of connection, is related to the difficulty in properly diagnosing hypothyroidism, because maybe the dog has a behavioral problems may be connected to something else, and you test the thyroid T4 and you find that it's low, and you say, oh wow, I found the solution. Most of the cases it's not that. But if I find a low T4, I should check why this dog has a low T4, and maybe I find a concurrent disorder.
Yeah, absolutely. And that's again, as a practitioner, oh God, I hate those conversations when you go back to the and you go, so we've got low T4. Now I've got to do a lot more looking, and they're like, oh, you've got to spend
Exactly.
money.
And this is not for owners. This is for vets. If you don't have a suspicion of a disorder, don't test for that disease. This is we already discussed about clinical signs and CBC and biochemistry. If you don't have the clinical sign, the CBC and biochemistry, don't do a thyroid panel, because maybe you find a T4 that is mildly low. And I forgot to mention that some breeds of dog, they have physiologically a bit lower total T4. For example, the greyhounds. If you check a greyhound and you look at the reference range of the lab that is for every breed, it's very easy to find a low T4. So remember that some breed, they have physiologically, normally, a bit lower total T4.
Yeah. Okay, so there's that dealt with. And would you happen to know the title of the paper for hypothyroidism and aggression? Because this
I don't have in mind, but I can send you the I don't remember. Sylvie,
when you get time, I'll nab it off you and I'll post it here. So next myths is, obviously we have a big following of people that really want to do the best for their dogs, and they will go to many lengths to do it. And they will buy into supplements and foods and diets. And there's a lot of talk about, oh, feed this, and, therefore it will supplement your dog's thyroid levels, has the components, the building blocks for the thyroid. What's your thoughts on all this?
My thought is that I think that this is a disease that when it's present should be properly treated with the right medication. When it's not present, it's not needed to give any specific kind of integration or medication, or not medication, I would say products that are within a diet, for example, because the disease is not present. This is, in my opinion, when the disease is present, should be treated, and the medication has almost no side effect if given at the right dosage. And of course, if we add something, for example, to the diet, sometimes we can just mask a situation that should be properly treated. And so I'm personally in favor of a precise diagnosis, precise treatment, and not I give something that could help with hypothyroidism. No, if it's hypothyroid, you have a super fantastic medication that it works perfectly if given at the right dosage. And this is what I recommend.
And so do you at any point go, here's the medication, and by the way, if you add this to your diet, it might help the medication work even more? I'm being facetious, because it's not, I meet so many adorable owners that just want to go the extra mile. And if you said, here's the medication, I'd be like, please, can I do something else? I'd like to do more. What more? What more can I do? I need to do more. And you're like, no, that's okay. That's all you need to do. You do not need to buy a supplement. You do not need to buy a thyroid impregnated blanket. The drug is enough. Do you suggest anything to augment your thyroid hormone?
No.
Yes. Yes.
No. I'm very, as a specialist, I am much in favor of the evidence-based medicine. And I think that it's more a psychological needed for the owner, for when they want absolutely to do something more, and they feel better because they are doing that. But I can tell you that from the scientific point of view, the effect is almost zero.
Perfect.
And
save your money for the blood test.
Exactly.
Yes. And I sometimes feel like I feel like a mother. I'm like, please stop spending your money on this, this, and this. Save it, put it in the bank, because we will need it for a blood test. You know, your dog's on long-term medication, or, you know, maybe we can invest that and having regular nail trimming and put some rugs down. That's where the money should go. Somebody's just said here, with humans, the meds work best on an empty stomach. Is it the same for dogs?
Yeah, it is. It is the same for dogs. It's better to give with an empty stomach. Sometimes it's impossible because the owner, I don't know, have just half an hour in the morning to feed the dog and give the medication. In that case, it's possible to give together with food, but usually we need a bit higher dosages of the medication in the long term. So if you can choose, better give the medication on an empty stomach. If it's impossible for logistic reasons, you can give it with food. What is important is decide always with food or always with an empty stomach. Not one day you do in one way and the other day in another way.
Good advice. That's great advice. I have to tell you, I said an owner the other day that was on twice daily antibiotics, and they came in and they'd been doing it once a day. And I was like, please, it's twice daily, so 12 hours apart. They came in the next week and went, well, we've decided to give it 3 times a day because we did a week where we only gave it once a day. I was like, ah!
Yeah.
So please try and stick to the label. And that's really great advice, Federico. If you're going to do it with food, stick it with food. If you're not going to do it with food, stick without the food. So that's good. Right. Last question. If some breeds automatically have a lower T4, is there a list of these breeds? Also, why are all breeds treated with the same protocols and levels?
So yeah, there's the greyhound in general, and all the greyhound, they have lower T4, and not only the breeds but also the age. For example, we know that older dogs they have lower values of T4, and also very trained dog. For example, dogs that are doing agility, they can have a bit lower values of thyroid hormones. So in this breed, if the vet should consider this aspect, and this is the reason why we don't believe in just a low T4 to do the diagnosis. The diagnosis is always a puzzle, looking at the signalement, looking at the history of the dog, looking at the clinical side, looking at pathology, looking at the biochemistry, looking at the T4 together with the TSH. And in some cases, some complicated cases, we do a second step that could be the scintigraphy of the TSH stimulation test. And of course, in these kind of dogs, for example, greyhounds or very old dogs, it's more common to have have some difficulties in interpreting the results. Talking about the treatment, there is no difference in treating, for example, a greyhound or a dog that is another breed dog.
Mm-hmm. Okay, cool. So I think we've done pretty well there. I was terrified of today, but it's been good. It's been good. I'm going to seriously twist your arm to talk about Cushing's at a later date this year because you're amazing. We're going to now do what we haven't done for weeks, which is the 10 top tips. And we do this because we want to make sure that CAM is hugely inclusive to everybody. It's always been my dream that we create this awesome community of owners that then feel empowered to tell other owners, who'll tell other owners, who'll tell other owners. And then we have this brilliant pyramid effect of spreading the word that arthritis is a welfare concern and we can do much more for it. So these 10 top tips are to make everybody kind of go, oh, the multimodal approach, the little things that count. So I'm going to do 10. Federico's going to do 9, I'll do 8, 7, 6, 5. He's going to be left with number 1. It has to be a biggie. It's got to be big. So number 10 top tip for me is weight control. I've stolen it. The biggie. Weight control. Oh my God, guys. I'm back in first opinion practice and I am at least 3/4 of the dogs that I'm seeing. I'm making a bit of a fun and joke. I'm kind of coming, oh, look, he's got love handles. Oh, he's a little bit podgy. Oh, feel the sponge cake. Oh, look, is he log or dog? And people are like, oh, she's so funny about it. No, I mean it. I really mean it. And I'm doing it all day, every day. We've completely forgotten what dogs should look like. And we know that carrying too much weight is a massive problem for osteoarthritis. You will see improvement in quality of life, improvement in pain control, improvement in cognitive function, improvement in your acute flare management, longevity. Your dog's going to live longer. So please, please, please get your dog's weight right. Number 9.
Me, number 9, of course, do a proper diagnosis, because of course we have the other points that are important, for sure. For example, the medication. So we have to be sure that the dog is sick for osteoarthritis, because the differential diagnosis of similar symptoms are many. So I would, similar to what I was mentioning for hypothyroidism, be sure that you are treating the right disease. So we need a proper diagnosis.
I agree. And that's a couple of clinicians got in touch with me saying, please, can we talk about peripheral neuropathies, for example, because people are being diagnosed that their dog's got arthritis when actually they've got peripheral neuropathies, connection with hypothyroid, and these dogs are not actually in pain. And they're being put on non-steroidals because they look weak and they look like their mobility is changing, but it isn't OA. So I like that one. Number 8 for me is please don't be shy of reassessments. I run a chronic pain clinic here in Bude. I absolutely love my work. And I can honestly say it is pretty rare, really unlikely, that if you come and see me that I'm not going to contribute more to your management plan. There's always bits we can tweak and we can adjust, we can double check, we can ensure that there's not a comorbidity, that the medication's safe, are we at the right weight, what other things can we do, what's new. Go for your reassessments, because a lot of dogs are put on medication and left there and they don't get their optimum response. Number 7.
Easy. Use pain medication. It's painful, and our dogs are not talking, but with osteoarthritis they have pain, and they are so happy when they're receiving the proper pain medication. So use it. Don't be shy. Don't try to find. Don't be against medication in general, because they can be. I don't want to. Sometimes I hear owners that I don't want to intoxicate my dog, but think that it's painful, and we know that when we have pain, it's terrible. And when we receive a pain medication, we are so happy. It's the same with dogs, so don't use them.
Yeah, I agree. I often take the mickey. I try and keep my consults lighthearted, and I pretend to be the dog. I'm like, hello, I don't really care. I want to have pain relief because I am painful. Please give me something that's going to work quickly. So I agree 100%. Number 6 for me is lifestyle. I spend a lot of time talking to my owners about the things that they choose to do with their dog. And just put a little bit of common sense in the picture. Make sure that you're not exacerbating your dog's condition. And a classic one is ball throwing. And I see this again at least once a day, where people have continued the activities that they did when their dog was fit and able and it could cope. But because that's their bond, and that's because their relationship, and that's what they get enjoyment out of, they continue to do it. But actually that is aggravating the condition. If a dog's got elbow A and they're braking and sharpening and turning and landing, that's going to really aggravate the condition. So think about adapting your lifestyle. Use your common sense and think, well, actually, if I had painful knees and I kept jumping down the bottom step and landing heavily, that's not going to help my knees. Use common sense. Number 5.
Number 5, we already talked about that, and it's connected to my previous recommendation. So give pain medication, but reevaluate the patient, because unfortunately there are no medication with 0 side effects. And of course we want to use properly our medication, but we want also check if everything is fine. So personally, I recommend after starting, also before starting, and after starting the treatment, check at least with the biochemistry and the urine analysis. Personally, I believe that it's very important to check at least the liver and kidney function in these animals, because usually everything is fine, but it's not a good idea to just focus on a pain medication and forget about everything, because maybe after some time you could find problems when it's a bit too late.
I like that one. Number 4 for me is, if you've been following Cam long enough, you'll know that when you have osteoarthritic change, you are going to have other forms of pain associated. So you're going to have your inflammatory pain within the joints, but you're also going to have myofascial pain. You might also have something called central sensitization, where the nervous system has wound itself up and it is perceiving more pain than is actually being created in the periphery, in the joints. So you've got different kinds of pain going on there. So what I really would like people to do is look at the bigger picture and not be scared of using multiple interventions. Some of my patients will be on 3 medications, plus they might be having massage, they might be doing therapeutic exercises, they might have had their lifestyle adjusted, they might have some massage, they might use heat sacks. All of this can help. So don't think osteoarthritic pain is just within that joint, that went, oh, the elbows are not right. There's going to be pain elsewhere in the body, so open your mind to what else you can do. Number 3.
Number 3, sorry if I'm stalling something that we already talked about. Search for concurrent disorders, and don't think that this could be the only problem. But usually, you have quite old dogs. They can also develop over time concurrent problems. You gave the good example of hypothyroidism, but there are so many other problems. For example, metabolic problems, sometimes when we are unlucky, tumors. And so remember that this is a geriatric patient. And of course, you have a diagnosis. Maybe you know how to treat that. But remember, especially when the condition is getting a bit worse, remember that could be just the osteoarthritis that is not doing very well, but potentially that could be something else.
Very, very good point. Number 2, my favorite, more rugs, less drugs. I'm really, really excited because only 2 weeks ago, in our waiting room at the vet's downstairs, I put a nice pot with half yoga mats. So I've got 3 yoga mats. I've cut them in half. I've rolled them up and I've put them in there. And there's a little sign saying, help yourself. The floor's slippery. Let your dog lay down with a good tractional surface. And they're being used. And you know, what did it cost to practice? 20 quid, nothing. And they're being used. And dogs really do appreciate being on a surface that gives them traction, because they are going to be painful. They are going to be more weak, and they might have associated conditions. So think about the flooring that your dog is living on and make sure it gives them good grip. Number 1 for you.
Wow, this is a big responsibility.
It is.
With number 1, I don't know, but I would say trust your vet. Trust your vet. I mean, I see several chronic problems and relevant chronic problems treated with Dr. Google. We call it when we want to do because we love our pet, we want to do our best, and so we decided to study and in internet to find a solution, because we think that could be the best solution. Remember that there are some vets that are studying for years and years to see which is the evidence to do the best thing in the animal. So I would say trust your vet.
Yeah, definitely. And being quite a community group, if you feel that you don't have a good rapport with your vet, if you do not feel the communication is working for you, then speak to the practice manager, speak to the reception, and just say, you know, I just don't feel I'm getting the rapport that I need for the long-term plan. Is there a vet in this practice that's really interested in geriatric or pain management? that I can make sure I see every single time, because you are the customer. So if you want to see the same vet, you can request that. And if you're finding you're still not getting what you need, there are lots of other vets out there. So please don't feel that you're suffering in silence, which is a CAM phrase. Do the best for yourself and your dog, and find a clinician that you can build up a rapport with. Just before we go, one little question. If started new meds like NSAIDs, how soon frequent would you check the liver function? I think you already covered that. You tend to get them to try and do one beforehand and then one within a few weeks of starting. Would that be fair?
Yeah.
Perfect. And there's one more here from Estonia. Big fan. Thanks. We like this. Do you use TSH for monitoring 2 or just T4? What if T4 is upper reference? So okay, but TSH still happening to be high, and the dog is still overweight and lethargic. Should this prompt for dosage increase? Crikey.
Yeah, this is a good question. Unfortunately, I don't have the perfect answer. So in humans, they look more at TSH. They want to see that the TSH that initially is elevated on treatment is normal. Unfortunately, all the studies in dogs where the study that are evaluating the monitoring of the treatment were focusing on total T4. And so we trust more the clinical sign and total T4. But the reason is that in the study, they didn't look very well at TSH. I think, my personal impression that in future studies, we should look more on TSH as well. So if I have to answer in a scientific way, I tell you just use the T4 and a clinical sign. If I have to give you my impression connected to what they are doing in human medicine, I would also check the TSH. And if the TSH is still elevated, especially if you still have some clinical sign, I would increase the dose even if T4 is okay.
Perfect. Like it. Oh, you're good. Well, so thank you so much for listening, CAM followers. Love educating, spreading the word. Please say thank you. Both me and Federico have been giving up our time. I've got to go back to work. He's prepping for lectures. It is a pleasure to do these lives, but they do take a lot of coordinating. So say thank you to Sarah as well, who organises getting our guest speakers in. Thank you very much to Big Barker for being our sponsor this year. We are hugely grateful. CAM is exorbitantly expensive to run now, so thank you, Big Barker, for making this happen. And the dude, thank you. You're coming back, definitely.
If I can talk about endocrinology, I'm happy to come back.
Yay! This makes me very happy. So thank you guys for listening. Thank you so much, Federico, and we will see you next week. Bye.
See you. Bye. Bye. Thank you.